There is good news tonight. If you've had a hard time finding a way to get a good night's sleep.
CBS 2's Dr. Max Gomez tells us there may now be a drug-free sleep solution. Dr. Max?
That's right, Christine. Maurice, you know, chronic insomnia afflicts up to 15% of all adults. And sleep deprivation is linked to everything from high blood pressure to depression, obesity, and even diabetes. That's why so many people turn to medications ranging from Benadryl to melatonin and Ambien. Here's a drug-free way to better sleep. If you think you've tried everything for insomnia, think again. Medical researchers say people with chronic insomnia can get a good night's sleep without drugs and without side effects.
So why don't you give it a try?
The solution is something called cognitive behavioral therapy, or CBT, a kind of talk therapy that teaches habits and relaxation techniques that promote sound sleep.
Cognitive behavioural therapy for insomnia includes up to 5 components that aim to improve patients' sleep by changing their attitudes and their behaviours around sleep. It works because it gets to the core of the problem, which is frustration with time spent awake in bed.
Researchers at the Melbourne Sleep Disorders Centre analysed data from 20 CBT studies in the Annals of Internal Medicine. They found CBT helped people with insomnia fall asleep about 20 minutes faster, cut the time they spend awake after falling asleep by 30 minutes, and improves the proportion of time they spend asleep when they're in bed by about 10%. Most anyone who's having trouble sleeping could be a candidate.
Most people, if they have difficulty falling asleep, difficulty staying asleep, or they're waking too early, and that's occurring several times a week for over a period of a couple months or longer, they could be a candidate.
This cognitive behavioral therapy does take some work and time, but a psychological approach to insomnia is safer, better tolerated, and teaches skills that can be maintained over time, as opposed to drug treatments that can have some negative side effects, which, of course, we've all heard of.
Takes time. We need it now, Doctor.
No, I mean, it takes time to go through all of the,
Yes.
Learn
all the
it,
therapy.
right?
We need it now.
I got it.
We don't have the patience. That's our problem, right?
I hear you.
Thank you, Dr. Max.
You bet.
All right, well, the